Hello, this is Angelica. I'm at the Osteopathy and Healing Center, and I'm going to be showing you what we do for craniosacral therapy. Number one, before you even start working on the cranium, you want to make sure that the neck is freed up, that Joey here is okay with the neck. As I do this, I'll just talk to you a little bit about cranial osteopathy. When you hear cranial osteopathy, you'll hear Sutherland, William Sutherland, mentioned a lot because he contributed a lot to cranial osteopathy. And his idea was that there is cranial movement, so there's bones in the cranium, that's what we call the cranium, and he had the idea that there was cranial bone movement. And he published a book, it's called The Cranial Bowl. He did his experiments on himself to prove that, for example, if he compresses one bone in the cranium, what kind of symptoms he experienced. And he talked about the sutures. So sutures are between bones and they help hold the bones together. So he talked about there being these sutures between the different cranial bones, and he said that they look like they're gills of fish. Same thing with Charlotte Weaver. She also looked at different dissections and also looked at the bones and these interdigitations between the bones as well. Okay, so now what I'm going to do is called an OA release. I'm right underneath his occiput, so that's a bone in the back of the cranium, and the first vertebrae in the neck, C1, or the atlas. So what I'm doing here is I'm just holding, waiting for a release. Now when it comes to the basic principles of osteopathy, they also apply when you're dealing with the cranium. Not just the rest of the body. The cranium is part of the body. So if you remember, the first principle of osteopathy is that the body is a dynamic unit of function. So I need to also look at his cranium, see if there's any dysfunction of the bones here and how they're moving, because that can also impact the different cranial nerves and different structures within the body. Now I go on the back to the occiput bone and I'm just checking that. And all I'm doing is I'm balancing here the occipital bone And that's going to allow Joey to heal on his own. So remember that the patient has their own inherent ability to heal. And also structure and function are interrelated, so that means I'm on the structure, which is the occiput for now, for example, but it's also going to affect the function, so what's going on underneath the bones. So for example, increase in the production of cerebrospinal fluid, or allow it to flow, nourishing his brain and his spinal cord, and also draining other toxins from the body. And I'm just going to have Joey take a nice deep breath in and out. So I can use his breathing to see if the bones are moving the way that they're supposed to. So embryologically, the bones move a certain way, and that's what I'm looking for right now, is that inherent movement. And I could use his breathing to increase or augment that movement, but the movement of the bones themselves happen by itself without the breathing. So it's like a separate mechanism. So Sutherland proposed that there is this fluctuation of the cerebral spinal fluid, or CSF, that I was talking about. And so there is this filling and resorption phase. And it could be felt. So right now I'm just on his parietal bone, and I'm balancing. And it's wonderful if you can go onto the internet and look at the membranes inside the skull or the cranium, and the spine. And then if you could just visualize or imagine those intracranial or intraspinal membranes moving. And if something is off, like a bone, it's going to impact the tension of those membranes. So there I was just decompressing the sagittal suture. Now I'm going onto his frontal bone. And you might have heard of people talk about Cranio-Sacral Therapy. So another part of this treatment is not only looking at the cranium and how the bones move, but also to look at the sacrum between the two hip bones, or the innominates, and seeing how that moves. Seeing how that whole mechanism moves, so the sacrum as well as the cranium. So now I'm just going to go and check his temporal bone. And there have been plethysmographies done to see the heads of like monkeys and cats to see this phenomena occurring. Also, surgeons as well can see this phenomena, and neurosurgeons. Okay, so we have there looking at the cranial bones, and we worked on his neck a little bit. Now I'm going to just do what's called the CV4. So in this fourth ventricle, we have things like the cerebellum and the vagus nerve that passes. It's very good for people who have problems with sleep.